postpartum bleeding, that is PPH, and also therefore reduces the risk of urinary tract infections. It promotes promotes a lower risk of postpartum depressions, because depression is quite common in the postnatal period. So by feeding the baby, it will boost the positive mood of the mother. That's what it creates a lot of good bonding, that is with the baby, with that of the mother. There are fewer chances of developing anemia among the mother, and there is fewer chances of ovarian cancer, breast cancer, which is very common among the ladies nowadays, and this is quietly contributed due to lack of breastfeeding to their babies. And there are rheumatoid arthritis, lupus, endometriosis, and diabetes, hypertension, cardiovascular disease are quite preventable when the mother continues by giving the breastfeeding to the babies. So this is what the quite beneficial for her even. And emotionally, breastfeeding boosts the level of soothing hormones like prolactin, oxytocin. These are the two hormones which are predominantly present during the breastfeeding. That is what it helps to boost the hormones, and keeping the mother the less stress. That is what it increases the confidence and self-esteem of the mother. Due to skin contact during breastfeeding, what happens? Breastfeeding increases the physical as well as emotional bonding between mother and the child, which helps to reduce kind of behavioral as well as social problems both in infants in the later life and also in among the mothers. So these are the very quite beneficial for the mother by feeding the baby with the breast milk. So let us see our topic, that is the protection of breastfeeding, promotion of breastfeeding, and supporting of breastfeeding. So let us know what is the meaning or definition of protection of breastfeeding. So whenever you think of protection, that means you have to protect the right of the mother. The right of the mother is what? No, the mother's right is to feed her baby as soon as the baby delivered. So that right we must protect. And also secondarily, we have to protect the right of the baby. The baby's first right is to get her mother's meal. That we need to give it to the babies at the first sight. So that is what all women enable to make informed decisions about infant feeding. That is what we need to give lot of informations whenever the mother is being conceiving. From during prenatal period itself, we need to convince them the benefits, the advantages of breastfeeding to the babies as well as mother, how to feed, what to feed, how much to feed in the breast, how long to feed in the breast, how many times we need to feed from the breast milk to the babies. So that is what, by avoiding different kind of formula feeding which is being marketed everywhere. So that is a bigger attraction to a mother nowadays. For all the modern ladies, what they do, by whenever they see lot of good marketing practices of regarding formula feeding, they just forget about breastfeeding. They continue to give the formula milk rather than breast milk. So that is what we need to protect the baby's right by giving mother's milk as his first right, and also protecting the mother's right to feed her babies. So that is what, and that feeding also can be possible at any time and anywhere, because whenever we feel hungry, we eat anywhere. Similarly, whenever the baby is being hungry, she should also have a chance to get breastfed wherever mother is, whether in the shopping, in the mall, or in the marketplaces, or in the workplaces, wherever it may be. So at times what happens, whenever mother goes out, the will become the breastfeeding will become affected a lot. So that is what, these all things needs to be protected. Wherever mother goes, should carry the baby and feed the baby whenever the baby demands. Because we will not see the watch and feed the baby. We have to feed the baby as the baby demands, like us. Okay? So that is what this is the protection means. Coming to the promotion of breastfeeding, what it does or what it means, that is promoting the importance of breastfeeding. Promoting the importance of breastfeeding over these formula feedings. So how we can promote? By providing adequate up to date information कि mother's milk में है क्या, or what is there in the mother's milk, what is unique characteristics in the mother milk, and why and what for we need to continue, we need to initiate, we need to continue exclusively up to 6 months. After 6 months we need to initiate or establish this complementary feeding, allowing it breastfeeding up to minimum 2 years of life or beyond as per World Health Organization's recommendations. So that is what you can only promote the breastfeeding by giving lot of informations regarding up-to-date informations to all the programming staffs, like whoever engaged or healthcare faculties, healthcare providers need to be trained, need to be given lot of orientation, continuing education programs need to be established so that they will become well versed regarding the techniques, the importance, the or every issues. There are many issues which may arise during the breastfeeding. So mother's issue need to be resolved from time to time so that mother will feel easy to continue breastfeeding as when it is required for the baby as per his or her demands. So promotion of breastfeeding only can be possible by training or giving them quite good information with several aspects, covering several aspects of breastfeeding to the healthcare providers from time to time so that we can promote breastfeeding rather than promoting this formula feeding. Coming to the third thing, that is supporting for breastfeeding. What it means by support? Because to though the breastfeeding seems to be very easy, but whenever mothers start up giving breastfeeding to the baby, really it is a very difficult task, and it is very difficult. Even many of the hospital, when we say the breastfeeding has to be initiated within first hour of birth, but many hospitals also even now they are not in a position to provide the breast milk, rather than they give packet milk, some of the milk which they may store and they give like that. So that way the colostrum feeding is being affected to the baby, which contains more amount of immunoglobulin that protect the baby from different kind of infection in the initial months. That way we have to, that can be supported. So this supporting of breastfeeding is very essential. So who can support to the mother? The mother can be supported. Let us begin from the healthcare providers, and whoever is in, whenever she goes to the hospital during prenatal period or during labor, or whenever she is in the hospital during postnatal period. So all this period, whenever she is in contact with the hospital or healthcare providers, must have support in each and every ways. And that way healthcare providers have lot of role in supporting the mother to initiate as well as to continue the breastfeeding in her place. And apart from that, the healthcare providers, we the family members, the partners, the peers, the mother to mother groups, as well as community as a whole, society as a whole, country as a whole, has lot of ways to support the mother directly or indirectly. That is what then only mother will be able to have more confidence and to continue the breastfeeding at least 2 years of baby. So that is what a mother needs to be supported from the beginning to till 2 years of life, so that this breastfeeding will not be affected to the baby at any way, so as to make the baby healthy as well as to keep the mothers healthy in the future endeavors. So that is what the woman, the mother, has to be supported in many ways in the form of what? Supported in form of giving lot of information, supported in form of counseling, supported in direct support, sometimes it is being required, or supported in terms of medical, whenever she has lot of medical problems related to breastfeeding, that also need to be supported, and practical technical aspect also need to be supported to the mother for effective breastfeedings, as well as sometimes she may need some of the interventions like pumping of the breast, and whenever she return back to the workplaces, she need to pump the breast so as to get a adequate amount of breast milk, so that baby can have this milk within the first or within the working hours. So that is what the supporting means. We need to, we all have a very essential role, beginning from the partners, the family members, the peers, the mothers and mother groups, and the community. They have got lot of role in form of information or in form of counseling or in form of direct support to the mother for complete initiation to complete establishment or continuation of breastfeeding till 2 years of age or beyond. So that is what about supporting a breastfeeding practices. So let us see why we need to protect, promote and support, because there are some low statistical reports has been found out from the various studies. So let us see what are the rates of breastfeeding. है ना? So everywhere we celebrate World Breastfeeding Week. Everywhere breastfeeding is being given lot of importances. Whenever you go to the OPD, postnatal ward, antenatal ward, breastfeeding is always being tough, always been a tough to the mother. But even then, what happens? That only 1 in 4 infants are exclusively breastfeeding. समझ रहे हो? What do you mean by exclusive breastfeeding means? Baby has to get from the beginning, from the only breast milk and only breast milk and only breast milk. No other things to be given to the baby up to the age of 6 months. That means sometimes some of the community, they have got lot of other social norms. They used to, they won't give the colostrum for about 3 days. After that only they start, and meanwhile they feed the baby with honey, some hot water, janam gutti, lot of things are there, are being practiced in several communities. Okay, so exclusive breastfeeding, baby should be fed with only breast milk. No, nothing is being required, because breast milk contain enough things what the baby actually need for the healthy growth and developments. So from the statistics, it has been seen that it is only 1 in 4 infants are exclusively breastfeed. That means 3 बच्चे को exclusively breastfeeding मिल ही नहीं रहा है. Understood? So secondly, globally, it has been seen that what the 38% of infants are exclusively breastfed. That means another 62% babies are not getting. So because of what? Due to lack of promotion, lack of protection, lack of support to the mother, so that mother is not able to continue effectively about the exclusive breastfeedings. And that is what it has been contribute around when the suboptimal breastfeeding contributes about how much mortality? 11.6% of mortality among under 5s. Understood? And about low rates of breastfeeding gives around 3 billion a year to medical cost of the mother and child. That means 3 billion of cost is being lost as we are not going to breastfeed the baby. That means if you breastfeed, you can save this much 3 billions of cost can be saved for the nations. This is about United States, and there are Arabs and corrupts of money is being lost due to inadequate breastfeeding of the baby, and therefore baby gets a lot of infections, and for infections a lot of problem health issues, for which the hospital cost, treatment cost, so many things are being lost. Okay. And currently in India, it has been seen that 55% of children are only exclusively breastfed, and around 45% of children in India are not exclusively breastfed. So from these statistics, you can very well observe that breastfeeding, though we talk everywhere, but the practices is very suboptimals, and those suboptimal practices are being contributed by what? By lack, due to lack of protection, promotion and support from all members of the societies. So let us see what contributes to the low rate. क्या कारण हो सकता है उसके लिए? कारण यही है, some of the social problems, some of the cultural problems, some of the health system problems, some of the commercial problems like marketing of different type of formula feeding, and sometimes what happens, there are a lot of social beliefs कि कोलेस्ट्रॉल वो अच्छा मिल्क नहीं रहता है, इसलिए बच्चे को नहीं देंगे. जो कोलेस्ट्रॉल 3 दिन तक आता है, so after 3 days only they start giving this mother's milk. They feel that after 3 days only mothers have good milk which can be fed to the babies, है ना. Due to thickening and due to yellowish color, people believe that these are the bad milk which need not to be given to the babies, whereas this milk is particularly has to be fed to the babies because it is contain high amount of protein, calories as well as immunoglobulins. So that education need to be given to the mother as well as to whole societies. families, partners everywhere, so that everybody has to contribute support to the mother, so that mother can feed the baby very effectively. And sometimes what happens, there are some hospital or healthcare practices itself, though we talk that following delivery we have to keep the baby on mother's abdomen, so that skin to skin contact and mother will crawl to get the mother's milk. But it is not being happen everywhere, all the hospitals, whereby the breastfeeding initiation being affected to a larger extent, and there is lack of adequate skill support. Sometimes some hospitals are there, but skill faculties are skill personals are not there, whereby they do not understand the breastfeeding has to be initiated soon after delivery. Therefore, the initiation also affected there, and also exclusive being breastfeeding also being affected. Sometimes there are poor family and social supports. Family, whenever there is a delivery, they after delivery 2 to 3 days, what happens? They think that now mother is well, okay, and she will go back to for preparing good food for the family, taking care of all other family members, and she will have no support from other members. They think that mother is enough to look after whole families, as well as giving or taking care of newborn baby, feeding the newborn baby. Feeding of a newborn baby, it looks very easy, but it is quite difficult. It takes from minutes to around 1 hour to feed at least to the baby perfectly. How much, or sometimes to for some newborn babies. So, due to lack of family support, due to lack of social support, what happen? Mother feels very discomfort, and mothers have a lack of attitude. कि चलो चल जाएगा, and therefore she needs or she choose the formula feedings, thereby whole process or systems or the whole principles of feeding to the baby with the breast milk gets affected. And sometimes the embarrassment about feeding in the public also is a kind of factors, because as in India you have never seen a mother to feed in the baby in the public areas like marketplaces, in the mall, in the school, wherever you may feel. That because there is no proper breastfeeding room, separate breastfeeding rooms where mother may feel comfortable and have privacy and have certain amenities to fulfill for feeding to the babies. Such facilities are not being available in India. So that is what mothers will not feel very free to feed the baby as the baby demands whenever she goes out. So that is what these are the common problems, these are the common factors which may contribute low rate of breastfeedings. So that can be achieved by how? By improving this family support to the mother, social support to the mother, and we should have some common places where, or in the mall you can have a very good place, and you should need to train to the healthcare providers by orientation as well as continuing education program regarding breastfeeding, like today we are doing for you all. Similarly, this breastfeeding week is being celebrated in the medical colleges as well as in this nursing colleges. And that is what wherever the hospital faculties are less aware about all these things and how it has to be initiated, what support need to be given to the mother after initiation, how much continuous motivation need to be given. This lack of education, lack of skill support to the mother, and whenever mother feels difficult during different type of issues, like soon after delivery, mother may have very much engorged breast. So with that engorged breast, how the mother is going to feed the baby? And with painful breast, mother is not able to do. In that way, hospital faculty or the who is skilled, who is expert in that particular area, she can support to the mother so that mother may continue the breastfeeding to the babies. Okay, so these are the different type of factors which may contribute for low rate of breastfeedings that need to be resolved. Therefore, thereby only we can able to promote and protect and support to the breastfeeding for effective practices. And sometimes it has been seen that there are aggressive promotion of formula milk is one of the factors. Inadequate maternity and paternity leave, because only central government they give 2 years of leave and state government gives another 6 months. And majority of the mothers you can see here, they work in a private setup whereby they get only 1 or something 1 month leave like that. After that they have to go back to their workplaces, so therefore the whole breastfeeding practices get affected. And सबसे ज़्यादा प्रॉब्लम क्या है ना, there is lack of knowledge among the mother about not exclusively breastfeeding. Whenever you do not feed, what is the problem may occur to the babies as well as mother, that is not being known by the mother itself as well as to the partner, to the family and whole healthcare providers and policy makers. So that need to be convinced कि नहीं पिलाने से क्या होगा, बच्चे को क्या होगा और माँ को क्या होगा. So this is the very essential part for us to learn today, the barriers of breastfeeding for a working mothers. Because working mother, because you are now the student and later you will be a future mother, must know what are the barriers for the breastfeeding. One is lack of knowledge about breastfeeding, misconception as a part of some social norm of the community, lactational problems like I told, flat nipple, sore nipple, engorgement of breast, a common है among the primary mothers. So that has to be resolved. Returning to work and accessing supportive childcare, poor family and social support, embarrassment. And here you can see some of the challenges of working mothers. So as a future, as I told that you will be in as a future mother who will be working also, है ना? So you have the similar type of challenges to initiate as well as to continue the breastfeeding, like inappropriate breastfeeding rooms. I told you, in whenever you go back to your workplace, you may not find a proper room to feed the babies, and where all other faculty member will be sitting, how you will feel lot of embarrassment to feed your babies. So that is difficult. Secondly, distance from working spots to the breastfeeding rooms is quite distance होने से mother will feel lot of fatigue, because breastfeeding itself is a fatigue affair and itself is tiring, for which we need to give lot of supports, है ना? And there will be lack of facility inside the particular room. There is कोई फ्रीज नहीं रहेगा, थोड़ा पानी भी रखने के लिए सुविधा नहीं रहेगा, and the fruit juices जैसा हम बोलते हैं ना कि before feeding to the baby, mother should get some fluid, है ना, some juices, some fruit juices. If it is that provision is not there, then secretion of breast milk will become very less, which will be inadequate for the babies. So such facilities should be there in the breastfeeding rooms, and there will be limited time to express the milk, because to express the milk it takes lot of time, it requires lot of patience, it requires lot of assistance, support. When the only minimum 15 minutes or 20 minutes is being given by the employers to go for breastfeeding to the babies, if at all permitted. So that time is not usually appropriate means adequate for having a effective breastfeeding. Then lack of support from the employers. Sometimes there will be no rooms, or sometimes they will not allow you to go back in between the class hours or in between the working hours to feed for the babies, है ना? And inaccessible to healthcare facilities. Sometimes you may have a lot of health issues, and therefore you may not have a accessible healthcare facilities in order to resolve your health issues. So these are the special challenges for the working mothers. Thereby, the exclusive breastfeeding as well as whole breastfeeding practices are getting affected very in a larger extent. So today's actually today we are here to hello. हाँ जी.
Can you hear me, Apilita?
Yes.
Hello.
हाँ yes बोलो. Hello. हाँ.
Yes. Good afternoon. Good Apilita. Actually, I like to introduce you. I was just late.
No problem.
ପିଲାମାନେ ଆମର faculty of principal ଅଭିଲେଖା ମୋର classmate, ଆଉ ସିଏ ହଉଛି first Florence Nightingale awardee ଆମର ଓଡ଼ିଶାର. ସମସ୍ତେ ଗୋଟେ clap କଲ ଅଭିଲେଖା madam କୁ. Please clap, all of you. And she is my friend, my classmate also. National Florence Nightingale awardee. And first National Florence Nightingale awardee from Odisha also. Our basic BSc alumni. So she is really, I am proud. My friend is the best friend. Thank you so much, Abhilekha. Sorry to disturb you. Continue. तोर slide नहीं कि change होने, please ठीक change करे. First slide रहेगा अच्छी.
अच्छा.
एक मिनट. हाँ.
एक मिनट.
Okay. हाँ change करे slide है. देखा जाओ नहीं तो first slide रहेगा अच्छी. Okay. Continue please. Thank you.
Yeah. Slide the view only. Slide view only.
ना ना स्लाइड देखा जाउची जे नेक्स्ट स्लाइड होउनी लो फर्स्ट स्लाइड रे एटा अछि इंट्रो स्लाइड हां एटा हला ओके ओके प्लीज कंटिन्यू
एबे हेला
हां एबे हला कंटिन्यू करे ओके थैंक यू ओके ओके हां
I'll talk about Manju madam and as I complete the class. Okay, just bear with me for another. Will be here for another 15 minutes. Okay, is that okay to you all? Hello.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Can you see my slides now? Can you see my slides?
Yes, ma'am.
Yes, ma'am.
Okay. Thank you, Manju madam. Actually, Manju is my very best friend. What I can say, more than my sisters. Anna, she is I am a Florence Nightingale, no doubt. But she is the first. What I can say, she is the very efficient lady, an efficient teacher, and very. What I can say, there is no words for her. She is the first person who can open a college, and that's a great proud for all of us, है ना? That one of my classmate, our roommate, our friend is being a director and leading a college there. It's another privilege for all of us, and we always keep on praying as well as we are really very much proud that she could bring a good college
thank you okay
in the state of Orissa. We are proud for that, and also she is maintaining the standards, both quality as well as in academic ways, and as well as in the extracurricular ways. Every day I used to watch and see. Though we have got limited time, I do not respond, but I used to see each and every step of your activities in the college as well as in the outside of your college. So God bless you all, and keep on moving, keep on growing. That's what I can only pray for all of you. And so let us see what are the ways we can protect. So far we have been seeing what is the importance, what it is, and what is the contributing factor, why it is being so nowadays, and what can be done. So that is what we will know, what are the ways and means to protect, promote, and support. So first strategy is to what? Create a breastfeeding friendly site. जहाँ भी मदर को जोठी भी मदर को मतलब whenever mother is feeding, the place should be very friendly, and whether in at home also she should get a room, a separate room where she will be much comfortable to sit or sleep or the way she likes to feed the babies. So wherever there is the sites, the breastfeeding room should be created where you can see the several type of posters, photographs, or a healthy baby who is being breastfed, the different type of stories, and so all these amenities will be there in the site. Then the mother will become motivated to feed her babies. So that site, that means that you should prepare a good rooms for feeding to the babies, and whether it is in the hospital or in the mall or it is in the school or it is in the college or it is at home. So create a breastfeeding friendly sites whereby mother will have free from embarrassment and can feed the baby comfortably and confidently. So that is what we need to create. Secondly, what we need to do, to keep the staff up to date, because I told you earlier, up to date information. Though breastfeeding is very common issue to everybody, but nobody knows when to start, how to start, or how much to start and how much to continue in each feed, how much time we need to give each breast, how much time we need to give, and what is the proper attachment during the effective feedings. ये सारा up to date information, or whenever there is different type of health issues, like I told you, in the primary mothers, the different type of breast problems like flat nipple, जो भी बच्चे को good attachment के लिए बहुत problem होता है. Secondly, flat nipples, है ना, and inverted nipples जो बच्चे को पिलाने के लिए बहुत problem होता है, and there will be engorged breast due to this flat nipple and inverted nipple. What happen? The baby is not able to suck well, and there is increase of breast milk. Thereby, breast gets engorgement. Severe engorgement will have lot of pains. So that issue also, how it has to be resolved, what type of protection to be given, or support or skill support to be given by the healthcare provider to the mother, so as to resolve these type of simple problems from the period of prenatal times, so that this can be resolved well before the mother could initiate breastfeeding to the to her babies. So that is what these type of information, the whole information behind regarding breastfeeding, its technique, various techniques, various advantages, what it contains, how, why to give. If you do not give, what is the problems the mother may have, the baby may have. All these things need to be updated to everybody, to the person who are engaged in breastfeedings. Okay, whether it be in the family, like family members, the grandparents, the partners, and or in the society, the peer groups, mother and mother groups. आजकल व्हाट्सएप है, जो जिन जिन को नया बच्चा पैदा हुआ, उनका ग्रुप रहता है, क्या क्या प्रॉब्लम है वो सब शेयर करते हैं, कहाँ हॉस्पिटल जाना है वो भी शेयर करते हैं. They give a right information to the mother in a practical way, so that they solve from time to time, and they continue for giving this breastfeeding effectively. So that is what in the healthcare provider or in the hospital setups and all, they need to have a very common, that is the orientation programs, as well as continue education program has to be continued, so that we can keep the healthcare provider very up to date regarding the breastfeeding issues, so that they can help or they can support to the mother as when they are in contact very effectively, so that the breastfeeding practices will not be hampered. Third strategy is what? To empower mothers to make informed decisions. That means mother need to be empowered, because mother and baby are related. First of all, mothers have a right to give to the babies her milk, and the baby's first right to get her mother's milk. So for that, mother need to be empowered with what? With lot of knowledges regarding breastfeeding, its advantages, its techniques, its timings, everything, and the small issues which may arise out of breastfeeding need to be educated, and the different type of how these issues can be resolved, that also to be educated to the mothers, so that mother may have after empowerment, after getting full knowledge regarding the breastfeeding to her babies, she will make a informed decision whether I should continue breastfeeding, initiate in a right time, and to continue the breastfeeding and एक्सक्लूसिवली फॉर 6 months. 6 month के बाद हमको ऊपरी आहार भी देना है, अलॉन्ग विथ ब्रेस्ट फीडिंग भी कंटिन्यू करना है साथ साथ. फिर ब्रेस्ट फीडिंग को अप टू 2 years मिनिमम तक ले जाना है, और इफ पॉसिबल इट कैन बी एक्सटेंडेड टू इवन आफ्टर 2 years. ठीक है. सो फर्स्ट ऑफ ऑल वी नीड टू एम्पावर द mothers whoever is pregnant. So from the time of prenatal period, that is what we always talk about, planned parenthood. जब भी मदर आए शुरुआत में, उसी समय से उसको सारा इंफॉर्मेशन देना है ब्रेस्ट रिगार्डिंग ब्रेस्ट केयर, निपुल केयर, and all those small problems, and easier way to feed the babies, when to start the feeding to the babies, why to give colostrum to the babies. All these things need to be given to the mother by the healthcare providers. ठीक है. So that she will make informed decisions. After जानने के बाद only वो अच्छा decision आपके लिए लेके बच्चे को effectively breastfeeding करा पाएगी. Next है respect to the needs of mother who choose not to breastfeed. Sometimes what happen, breastfeeding करना थोड़ा contraindicated cases रहता है, like hepatitis B, acute cases of hepatitis B जो blood के माध्यम से आता है, and mother's milk में भी आ जाता है बेबी को, and when the mother is having HIV especially, or when the mother is having acute condition of tuberculosis. In this way what happens, the breastfeeding is being contraindicated. That time mother will choose, I'll not go for breastfeeding, I'll go for formula feeding. That time we need to respect, and you need to inform to the mother कि what is the safest way of feeding to the mother baby, है ना. फॉर्मूला मिल्क पिलाएंगे, बट कैसे पिलाएंगे? बाय यूजिंग द कटोरी एंड स्पून. उसका क्लीनिंग में ध्यान देना है, अमाउंट में ध्यान देना है, अप्रोप्रिएट अमाउंट में ध्यान देना है, ताकि बच्चे को माल न्यूट्रिशन डेवलप ना कर जाए. इफ देयर इज एनी केस ऑफ इंडाइजेशन डायरिया, दैट हैज टू बी रिजॉल्व फ्रॉम द वेरी बिगिनिंग बाय रेफरिंग टू द नियर बाई हेल्थ सेंटर्स, है ना. ऑल दिस थिंग्स नीड टू बी इन्फॉर्म टू द मदर. And fourth way, that is identify barriers and explore the solutions. I told you before that we have discussed different kind of barriers like lack of knowledge, lack of technique, lack of social support, and some of the cultural practices, some of the social norms. ये सारे चीज को हम एक्सप्लोर करेंगे और उसके साथ साथ उनको अप्रोप्रिएट नॉलेज देंगे सो दैट mother will be empowered to continue the breastfeedings and sustain support beyond initiations. What is that means? That means whenever the mother, we are nowadays we are telling that to have the hospitalized delivery, है ना? So whenever baby is being born in the hospital, they initiate the breastfeeding in the within first hour of following birth. But what happens after that? Afterwards, what happens when the mother get discharged from the hospital to home? Home there is lack of support. Lack of support by the partner, by the family members. There is lack of food for her at the homes, and nobody is there to help the baby. She has to look after the new baby, the other babies at the home, the whole family issues, as well as cooking the food for whole family, as well as cooking food for herself is very tiring for her. So that is what once you will have lot of the problems, then she will have little less attitude for continuing the breastfeeding. So that is what once it is initiated, that has to be continued with everybody's supports. And first of all support from the healthcare agencies, then support by the partners. पार्टनर्स क्या कर सकता है फॉर बेबी को नो व्हेनेवर द बेबी इज क्राइंग उसको सेटल कर भी सकता है आफ्टर फीडिंग द पार्टनर कैन बर्ब टू द बेबी and in the during night time mother is very tired and also moreover with lot of delivery or episiotomy pain में मां रहती है तो उस टाइम में पार्टनर कैन हेल्प है ना and changing the napkin also partner can help. Partner can see that a mother what the mother should eat so that there will be adequate milk for the secretion of milk for the baby. So that food he has to be bring has to cook for her and must present in a very colorful way to in front of the mother and facilitate good food for the mother so that mothers will be healthy so that she will have a very good strength to continue and good attitude to continue the breastfeeding to the babies. So that is what for initiation it is very easy, but for continuing mother requires lot of support from everybody. That's what include families, partners and friends for facilitating breastfeedings. Family members, the other family members also has got lot of roles in facilitating mothers. And friends also equal role for facilitating mothers for continuing the breastfeeding practices and encourage peer breastfeeding support groups. That's what I told you. Mother to mother groups are being created, thereby they could resolve one, they could share their breastfeeding experiences and also they could share different type of problems which may arise out of the breastfeedings to the baby and that can be resolved with among themselves. And the last one is the community participations, because community is where the mother is always belonging. So in community indirectly they should have lot of facilities or the lot of facilitation for the breastfeeding practices. So these are the different strategies, and let us see what are the breastfeeding friendly community. What are the characteristics? We can say the community is breastfeeding friendly. So that means the community must have an attitude to protect, promote, support breastfeedings and must work together, must arrange education from time to time and must inform the required information to the mother by, and also the communities has a attitude to continue the breastfeeding by changing the attitude of this bottle feedings and all, and must support the mother baby relationship well and must support the need to the mother and baby friendly, and there should be a provision of extended maternity leave. हमारा कॉलेज स्कूल वर्किंग प्लेसेस में प्रोविजन रहना चाहिए कि there should be extended maternity leave up to 6 months so that we can effectively continue exclusively breastfeeding for the baby. If there is no leave, then mother has to come back to the college or to the workplace so that exclusive breastfeeding will affect a larger extent. And also the community should have a goal to breastfeed and reserve their feelings to find the most suitable alternatives. So the breastfeeding friendly community means they should help for breastfeeding, they should facilitate for breastfeeding by supporting mother and baby relationship. So that is what the role of nurses are quite very much essential from the period of, I told you, from the conception to after or even after deliveries. So there are various settings you can see here. Prenatal nurse, that is before delivery. Labor room nurse, that is during delivery. Postnatal nurse, that is after delivery. Nursery nurse, whenever the baby is preterm or post-term or having any kind of anomalies. And the pediatric nurse, when the baby is after neonatal periods, है ना? So the different nurses have a different role for facilitating, protecting, promoting, supporting to the mother for initiation to continuation of the breastfeeding. So what a prenatal nurse can do, I told you, she can sort out different type of health issues or different type of breast conditions. She can assess, she can prepare. If there be any kind of flat nipple, so flat nipple as well as inverted nipple, that the solution also advice also she can counsel, motivate to the mother for doing for the particular problems, and also educate the mother different kind of advantages of the breastfeeding. That is her role, to examine, to identify the problem, solve the problem, give lot of information regarding, and she should prepare the mother how to feed the baby after the delivery. It is her role. Delivery nurses का major role is what? कि to first start the breast milk to the baby within an hour, है ना? That is what. And in the postnatal room, the postnatal nurse has role is mainly to watch the mother and baby, and whether they are in together or not, and see adequate of milk is there or not. Then whether mother is feeding from time to time to the baby or not. That is her role. Coming to the nursery nurse, she should support the breastfeeding by refraining from giving the baby with other fluids. कोई दूसरा fluid देना नहीं है. She has to support in directly she should support to the mother by giving the breastfeeding to the babies. And the pediatric nurse's role ये है कि has to help the mother giving continuous counseling. जब जब वो हॉस्पिटल है तब तब वो बताए कि breastfeeding करा रहे हो, ठीक करा रहे हो तो ठीक, कैसे और करेंगे, कब तक एक्सक्लूसिव ब्रेस्टफीडिंग करेंगे, कॉम्प्लीमेंट्री डाइट क्या क्या शुरू करेंगे, और उसके साथ साथ कितना बार ब्रेस्टफीडिंग देना है, एंड ब्रेस्टफीडिंग कब तक 2 साल तक कंटिन्यू करना है. ये चीज उनको कंटिन्यूअस बार बार बोलने से ओनली they will be positively motivated to continue the breastfeeding. So that is what various nurses has various role to play for protecting and supporting the breastfeeding to the baby. So that is what we know the World Health Organization recommendation regarding feeding of the infant and young child. That is what the breastfeeding to be initiated within 1 hour of birth. Okay, and it has to be baby should be exclusively breastfed for 6 months of life. Third thing is what the infant continue breastfeeding at least 2 years of age, and between that what happened, the infant be introduced to adequate safe complementary foods beginning at the 6 month of the age. This is what the correct principles for feeding of the infant. Initiate within an hour, continue exclusively till 6 months. After 6 months you should introduce complementary feeding, and after along with that side by side breastfeeding also will be continued till 2 years of age. So that is your WHO recommendation. What you can say the principles of breastfeeding. So that is what. Let us come to a conclusion. This protecting, promoting, supporting breastfeeding will save many lives of the babies, children, and even lives of the mother. Globally, exclusive and continued breastfeeding could help at least prevent 13% of deaths of under 5s. And those babies who are breastfed, they have fewer childhood infection, fewer chronic diseases, and extra IQs, and having adding potentials, more opportunity to prioritize education and healthier mothers. And breastfeeding reduces the burden on society in terms of health spending. I told you earlier that hospitalization as well as loss of money due to absenteeism. So it also saves families money by protecting the baby from not getting any kind of disease, as well as protecting the mother for not getting any kind of disease like ovarian cancer, uterine, breast cancers, because it obviates the needs of the commercial substitutes. So at last we can see that, remember, the breastfeeding is an investment in the health. So हमेशा we invest in the money, no? Let us invest in the breastfeeding so that money also save हो जाएगा. So breastfeeding is an investment in health, not just a lifestyle decisions. Is it okay up to everybody? Is there any doubt? Please, you can have a time to ask. Hello? 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 Lulu?
Yes, ma'am.
Hello? Hello?
Yes, ma'am. You are audible, ma'am.
Okay. What I'm telling you, with
Yes,
this I
ma'am.
could conclude. Is there any doubt, anybody? Please may ask. Before concluding, I can extend again my heartiest thanks to Mr. Narandas, who is also a friend to us, Hannah. Was very helping every now and then whenever we studied at the BS Nursing, also in MS Nursing, also while we are working in Tamil Nadu. We will never forget him. And he, due to his extraordinary potential, both Jaganaran Das and Mrs. Manjuvala, Dr. Manjuvala Panda and Sumanji, this college has come to a reality. Anna, so God bless you all. Keep on moving. And if there is any doubt, children, please ask.
Good afternoon, ma'am.
Very good afternoon.
Ma'am, I have a doubt that how to promote breastfeeding.
How to promote breastfeeding? That I told you, no, ki there are 8 strategies that you should have a. You see now this slide. You should have a very create a create the slide is visible to you all. Hello.
Yes, ma'am. It's visible.
You see the create a breastfeeding friendly sites, and a simple language you can say whoever is there surroundings the mother, and the mother is belongs to a family. So the role of partner, the role of families, the role of friends, the role of society as a whole, the role of community, and also the role of healthcare providers like we. Everybody has a role to play to facilitate for the breastfeeding. How? Now by informing the mother and regarding the different techniques, advantages, role, and the effects of not breastfeeding to the babies. है ना? And that is what by informing, by counseling, by motivating, by exploring different type of barriers of the mother and giving the different solution to them, and I'm getting a good orientation program for the healthcare providers, as well as making continuing education programs from time to time regarding the up-to-date information of breastfeeding. In this way, we can able to protect the breastfeedings, है ना? From initiation to continuing till 2 years of age. Got it?
Thank you, ma'am.
Anybody? Okay, if you have no doubt, Madam, over to you. Thank you once again to Madam Jacob, Principal Kasturba College of Nursing, and all the dynamic faculty members of Kasturba College of Nursing, including the esteemed guest and esteemed management. Once again, my heartiest thanks to everyone for giving me such a wonderful opportunity to be a part of your programs today. So thank you all. Thank you, students. God bless you all. Have a very good time ahead.
Thank you, ma'am.
ma'am.
Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am, for sharing this valuable knowledge regarding breastfeeding. Now, I would like to request Professor Dr. Anusya Patnaik Ma'am, Professor and HOD, Department of Community Health Nursing, KIMS Bhubaneswar, to enlighten our audience regarding community support for successful exclusive breastfeeding. Over to you, ma'am.
Anusaya madam, good afternoon ma'am. And she is our senior of our College of Nursing, and also very good administrator during her time and now also. And she has worked various colleges as principal, and at present she is working as a professor and HOD of Community Health Nursing and KIT deemed university. So madam, really it is our pleasure that you are here today with us. Thank you so much madam for accepting our invitation and enlightening your knowledge to our students of Kasturba College of Nursing. Thank you, the previous speaker Abhilekha madam, and now welcoming to Anu ma'am to this session.
Okay. Thank you, Manju ma'am, for your nice introduction. And breastfeeding is 90% determination and 10% milk production. Good afternoon, one and all. Respected Chief Patron, Dr. Jaganarayan Das, Patron SK Senapati, Directors and Principals and faculties, and all the participants and the eminent speakers who are present over here. Today, on the occasion of World Breastfeeding Week, we are giving me the opportunity to be a speaker on this important event. So, before me, Abhilekha ma'am explained the topic so nicely, and I hope the students are getting very good knowledge about the breastfeeding week or the supporting or promoting breastfeeding. And today we are discussing a very important topic, that is the community support for successful exclusive breastfeeding. I am very much thankful to the Dr. Manju Das and the management of Kasturba College of Nursing, as they are giving me this opportunity, and this is a proud privilege for me also, that Manju ma'am, though she is junior to me during our peace nursing period, but really she is a good entrepreneur, as she is opening such a nice institution in the Barampur. So congratulations Manju ma'am, and I hope this college is having a bright future, because as she is a good and renowned professional in the nursing field, so definitely the future of the students and the future of the college is bright. I hope so. Again, once again, congratulations to all of you, as you are selecting such a nice institution for your bright future. Thank you all.
Thank you so much, madam. Thank you.
So, breastfeeding offers society not only improving the health of the children and mothers, but also economic and environmental benefit. Because breast milk is naturally a renewable resource that requires no packaging, shipping, or disposal. It contains antibodies that help your baby fight off viruses and bacteria, lowers the risk of different diseases. So, give newborn infants no food or drink other than breast milk, unless it is indicated medically. So, today we will discuss about support of community for successful exclusive breastfeeding. I think by this discussion you can able to know what is exclusive breastfeeding. And here we are having a great role to encourage the breastfeeding frequently day and night and advise the mother allow the baby to feed for as long as he or she wants. That is demand feeding. So reassure the parents that there is no need to give other food or drink and exclusive breastfeeding is fantastic. So breastfeeding is an important strategy in the promotion of child's health. Until now also, globally, the breastfeeding is only 41% of all babies. They are in exclusive breastfeeding for 6 months only. And now, the 45% of the children or the baby are continuing to breastfeed up to 2 years. So till now also we are not able to achieve our goal. And the 3 in every 5 babies are not breastfed in their first hour of life because you see the breastfeeding it should be started within 1 hour of the birth of the baby. So breast milk works like a baby's first vaccine, protecting infants from potentially deadly diseases and giving them all the nourishment they need to survive and thrive. This is according to World Health Organization. WHO recommends exclusive breastfeeding for the first 6 months of an infant's life. Thereafter, local nutritious food should be introduced, while breastfeeding continues for up to 2 years or beyond. Follow formula is therefore unnecessary. In addition, follow formula is not a suitable substitute for breast milk due to its content. So, nothing can be replaced the breast milk. That's why the breastfeeding is the best feeding. So nothing is there to replace it. In current statistics of breastfeeding, globally the World Health Assembly has set a target to increase the exclusive breastfeeding rate to 50% by 2025. Because till now the globally it is only 41%. So the target is to increase it to 50% by 2025. In India, less than 50% of children are breastfed within an hour of birth, whereas the rate of exclusive breastfeeding in the first 6 months stood at 55%. Early initiation of breastfeeding and exclusive breastfeeding can prevent nearly 99,499 deaths of children every year due to diarrhea and pneumonia. You see, mostly the babies that is under 5 deaths or more, and if breastfeeding is there, then automatically we can able to prevent it. The exclusive breastfeeding rate that is 55%, and the global goal is 50%. The India is in at the rate of 55%. So all countries must reach an exclusive rate of 50% by 2025. According to National Family Health Survey in India, the fourth National Family Health Survey shows that breastfeeding decreased by around 10% points in children 6 to 8 months of age after they start receiving semi-solid food. Effect of breastfeeding on economy. India is among the world's 5 largest emerging economies where investment in breastfeeding is significantly low, resulting in an annual economic loss of $14 billion due to child deaths and cognitive losses. This is caused from poor breastfeeding practice. It is according to Times of India report. So, the breastfeeding is also providing support to the economy. According to the Times of India report 2017, it shows an annual investment of only $4.70 per newborn is required to increase the global rate of exclusive breastfeeding among children under 6 months. It suggests that meeting this target could save the lives of 5,20,000 children under the age of 5 and potentially generate $300 billion of economic gains over 10 years from reduced illness and healthcare costs and increased productivity. Currently, India suffers economic losses because only 55% of children are exclusively breastfed. And these economic losses are resulting in higher health systems costs. Because if we are able to provide 100% exclusive breastfeeding, then automatically we can able to prevent the so many diseases like diarrhea or infectious diseases or non-infectious diseases also. Because due to breastfeeding, you know that the immunity system of the baby will be more strong. So the children and mothers develop illness which can be prevented by providing breastfeeding. That's why the support or the practice of breastfeeding is very essential. And lost productivity because children who are not breastfed, they are less likely to fully develop and fully contribute to the economy. In future, those child may not be productive one. That's why breastfeeding is important. And higher household expenditures as families need to purchase breast milk substitutes. You know what is the cost of a formula feeding? It is very costly also. That's why instead of breast milk, if we are giving formula feeding or that rubber, then it will also affect the economy of the family. That is, it is very costly. So, keeping in view of that also, we may give breastfeeding to reduce the expenditure of the family. An impact of inadequate breastfeeding. Why you support breastfeeding? That's why you must know the impact. If the breastfeeding is inadequate, then what are the effects or impacts? In India, the health system incur costs when treating illnesses that could have been prevented by breastfeeding. In health system, you see the type 2 diabetes in mothers. That is, it costs 43,45,470 and the diarrhea in children also, that also costs the illness due to illness also, the cost is very high. And acute respiratory infection, pneumonia in children, these are all also due to the inadequate breastfeeding. Already we discussed that due to inadequate breastfeeding, the immune system may not develop properly. And the total in USD, this is the cost. And total as a percentage of gross national income, that is 0.005%. If we are not able to provide adequate breastfeeding, then we may suffer. And the impact is like this. And the human cost of non-breastfeeding in India. How it affects the human cost. That is, you see, how the diseases are also more common among the non-breastfed children. So when children are not breastfed, they are at higher risk of illness and death comparative to the breastfeeding children. Later in life, mothers who do not breastfeed are more prone to develop life-altering and life-threatening cancers and type 2 diabetes. The report also highlights the growing number of deaths in India among women due to cancer, while type 2 diabetes is also attributable to inadequate breastfeeding. This is according to the report of Times of India 2017. So this breastfeeding is beneficial to both mother and the child. If the mother is not able to breastfeed also, in later life also, she may suffer cancer or type 2 diabetes mellitus. This is according to the Report of Times of India. Then morbidity and mortality also affected by the inadequate breastfeeding or non-breastfeeding. So you see diarrhea, this diarrhea can be preventable if we are able to provide the breastfeeding, then this diarrhea can be preventable. So you see what is the number of diarrhea cases among mothers and among children, and how the number is so more. And the acute respiratory infection also is also very high. The rate is very high among the children and also again in the mother. And obesity also, if we are giving formula feeding, then again it is causing obesity. So these are the impact of non-breastfeeding on morbidity and mortality in both mother and the child. Then baby-friendly hospital initiative, because you see the community support that is very, very essential for the mother and the baby. So community also again includes the family and the family members or society or the that is the partner, that is the father. Okay, so these are the members who can support the mother and the baby and who can provide a conducive environment for breastfeeding. So the World Health Organization and UNICEF launched the Baby Friendly Hospital Initiative, by which the breastfeeding can be successful. This is a great support. That is BFHI. It is based on 10 steps to successful breastfeeding. And the objective is to improve breastfeeding practices in the hospitals with maternity services. That is, the breastfeeding must be successful one. This is according to the BFHI, and this BFHI is launched by WHO and UNICEF. In 2016, the Ministry of Health and Family Welfare, Government of India, launched the Mother's Absolute Affection, that is MAA, MAA, Mother's Absolute Affection. This is also launched. This is one of the programs launched in the year 2016 to revitalize the efforts towards protection, promotion, and support of breastfeeding practices through health system to achieve higher breastfeeding rates. Am I audible to you all? Hello?
Yes, ma'am.
Yes, ma'am.
So the 10 steps to successful breastfeeding. You see, the 10 steps. That is the hospital policies. The number one is the hospital policy. You see, hospital always support the mothers to breastfeed. They should not, that is, guide the mother or encourage the mother for the any other food. They should support. They must support for breastfeeding, not promoting the infant formula feeding or bottle feeding or teats. That is the duty of the hospital, and the policy is there also in the hospital that they must support the breastfeeding. Then making breastfeeding care standard practice. That is, the standard practice must be there. When we at the health personnel, suppose if people today you are the student, when you are going to hospital also for your duty in the maternity ward, then also in the community, always you encourage the mothers, you support the mothers that they must continue breastfeeding. By breastfeeding only, they both will be benefited, that the mother and the child. Then again, you know what are the other factors like financial benefit also there. So that the breastfeeding care standard practice must be implemented by the hospital. At that time, as a health personnel, we must train the mothers, that is by giving the teaching them the breastfeeding technique and keeping track of support for breastfeeding. Okay, so this is the hospital policy by which the mother can be encouraged, mother can be supported, and mother can be taught about breastfeeding. Then staff competency. So who is there to guide the mothers? This is our staff. Mostly the nursing professional, because the nursing professional at the number is so huge. They are the main. They are the having the main role in the hospital to guiding the mother. So hospitals support the mothers to breastfeed means you feel yourself. You are the key members in the hospital, those who can guide the mother properly. So it needs your competence. Staff competence means your competence. So training the staff on supporting mothers to breastfeed. Then assessor. In the hospital, the staff should be trained properly how to support the mother. Then assessing the health workers' knowledge and skills. We must assess the knowledge of the health workers. How much skill they are. By that only they can able to teach the mother about the breastfeeding technique. Okay, so this is the staff competence. And number 3 is antenatal care. Hospitals support mothers to breastfeed by discussing the importance of breastfeeding for babies and mothers, preparing women in how to feed their baby. Because you see, the antenatal period is the best period when we can teach the mother, when we can counsel the mother, we can prepare the mother mentally and physically. That just after birth, within 1 hour maximum, they must start the breastfeeding. So, during antenatal period, we must teach the mother on breastfeeding, how it is beneficial to the mother and beneficial to the baby, and what are the advantages, what are the benefits, what are the techniques, everything we must teach. So that's why during antenatal period, the hospital also, when the mother is coming to the antenatal, that is OPD, at that time we must teach by discussing the importance of breastfeeding with babies and the mothers. The discussion must be with the mother and prepare the mother or prepare the woman how to feed their baby by teaching the breastfeeding technique. And the fourth step is care right after birth. That is, just after birth, we are trying to breastfeed the baby. So encourage the mother, that is skin to skin contact between the mother and the baby soon after birth. If the baby is breastfeeding started, then automatically the skin to skin contact also possible. That is stronger mother care. And by that the baby also get the mental satisfaction, that is the mental development or the attachment with the baby is be better. And helping the mothers to put their baby to the breast right away. It is always we must be there to help. As a health professional, we must be there to help the mother in a right way. Okay. And the fifth step is support the mothers with breastfeeding. That is the hospitals. Everything, because nowadays home delivery is not there and institutional delivery is there. So from the just after birth in the institution or the hospital, always support the mother to breastfeed by checking the positioning, attachment and suckling. That is the breastfeeding technique. In which position the mother should feed the baby. That should be checked. That is checking the position. Then attachment. How the baby lips is, the mouth is attached to the nipple of the breast or not. Whether she is or he is suckling properly or not. That should be observed. That should be trained to the mother and giving practical breastfeeding support. That is the best support. Okay. So helping the mothers with common breastfeeding problems. If there is some common problems are there, we must elaborate, we must discuss with the mother. By that, the mother will also feel that yes, someone is there to guide me, to support me, or to counsel me, or if anything is wrong also they will guide me, so they will develop confidence with you. That's why always you help the mother for the if there is any problem. So that is the support the mothers with breastfeeding. Then sixth step is the supplementing. Supplementing, that is supplement. This is the additional things. When we are supplementing, that is giving only breast milk unless there are medical reasons. You see, up to 6 months, there should be no supplementation. That is exclusive breastfeeding is mandatory. So, if giving only breast milk is essential. If there is any medical reasons, then at that time the supplementation may be there. The prioritizing the donor human milk when a supplement is needed. So when supplement is needed, we must prioritize. The prioritization must be given to the donor human milk. The donors are also available. That is, the human milk can be preserved and that can be also substituted. So that is also available. So we must prioritize on that. Then helping the mothers who want to formula feed to do so safely. That is, if the formula feeding is there due to any medical reason, then you help the mother. Okay, that she can do safely. And seventh is rooming in. That is, the letting the mothers and the babies stay together. Always, that is in day and night. They must be stay together. By that their contact, close contact or attachment or mental development is there. So making sure that mothers of sick babies can stay near their babies. So if the baby is sick and they are keeping away, also the mother should be there. That is rooming in. And responsive feeding, that is helping the mothers to know when their baby is hungry. That is always, that is demand feeding. When the baby is hungry, the mother should give, should feed. So that is, you always help. You must help the mother, and she should able to know when the baby is hungry. Then not limiting the breastfeeding times. There is no limitation. That is demand feeding. Then bottles, treats, and pacifiers. That is, the counsel the mothers on the use and risks of feeding bottles, treats, and pacifiers. That we must counsel the mother that what are the risks of the bottle feeding, how the diarrhea is more common in bottle feeding, or how the infection chances of infection is more if the baby is taking the outside food. Okay, so what are the difficulties in bottle feeding? This must be taught to the mother. Then discharge. The last step is the discharge. So when we are discharging, the mother must be referred to the community resources for breastfeeding support. If the support from the hospital, if when the mother is leaving, you know that so many health workers are posted in the community, the ASA workers, Anganwadi workers, or the AIIMS, or any other according to the that is the feasibility. We must refer. She should take the that is the information from them. Then working with communities to improve breastfeeding support services. If it is the, we must keep contact with the community. That is by that they will be in touch with the mother, and by that also the breastfeeding can be improved. Then another one is IYCF. That is infant and young child feeding. This is also one of the support group model, and it is based on 3 types of support groups facilitated by trained staff, that is including a monthly breastfeeding group for pregnant women and mothers with infants aged 0 to 6 months, and a monthly complementary feeding group of mothers and caregivers of children 6 to 24 months, and a community support group for fathers, grandparents, and village leaders. Information about appropriate IUIs CF practices. And to address IUICF misconceptions was delivered through the group. That is, these are the groups, that is the 3 types of support groups which are facilitated by the trained staff. And those groups will help the mother, will encourage the mother or facilitate the breastfeeding. The purpose of this is to evaluate the impact of IUICF support group in improving child feeding practices and reducing the stunting among children under 2 years. So many research are done, and whatever we see that the child feeding practices can reduce the stunting among the children under 2 years. And based on the theory of change, the study sought to determine whether the intervention significantly changed this infant young child feeding practice among the target population and identify the effect of the intervention on stunting among children under 2 years of age. So by this, we can able to reduce, if we are able to breastfeed the baby timely, and that is the exclusive breastfeeding, and up to 2 years also we can give with the complementary feeding, then the stunting or the different types of diseases rate can be reduced among the children. And through group meeting, exclusive, that is, one is exclusive breastfeeding group, and that is the another group meeting for complementary feeding. That is the support group is also there. One is for exclusive breastfeeding, and another one is for complementary feeding, then community support group. And these are the activities which can be done by this group meeting, different group meeting. And this is, you see, by the exclusive breastfeeding, you can improve the knowledge that can be reduced in the socio-cultural misconception. You see, so many misconceptions are present in different communities. So this misconception can be out with the help of this support group, and the environment that can be enabled, and the support from family is very important. And this, according to this community on IUICF and care during first 1000 days is very important. And the output will be better if we are able to give, that is the, keep the baby, but that is the first 1000 days is very important for the baby. Then change in practice, that is exclusive breastfeeding is and age-appropriate complementary feeding, increase access to health service during pregnancy, delivery, and postnatal period. Then the reduction in child undernutrition, that is the impact. Okay, the outcome or the output due to these activities, when we are giving this support to the groups, then only the impact will be more better in reducing then child undernutrition. The undernutrition can be reduced. In the National Plan of Action on IUICF, including the promotion of community-based support groups. That is, the community support can be provided to the mothers for exclusive breastfeeding, that is by these community-based support groups. By building the capacity of management, coordination, development of IUICF and maternal health related policies. That is, develop, prioritize IUICF intervention package for each province, district, and vulnerable group to centralize the resources and strengthen the effectiveness of interventions. It enhances advocacy efforts and behavior change communication on infant and young child feeding and maternal health. So, strengthen the roles of community-based support groups can be possible through this IUICF counseling. That is, infant and young child feeding counseling is very important, by which we can able to strengthen the roles of community-based support group. That support group can help the mother in this way. The build capacity of health workers at all levels on IUICF and maternal health. That is, the capacity building of health workers is very important. Then accelerate coordination, planning, monitoring, and supervision activities among government agencies, mass media, and international organizations. You see, Now government is also very active, and so many programs are going on for encouraging the mothers also. The mass media is always there is the what discussion in the last 2 days I saw that the Odisha government, particularly the Odisha government, is spending crores of rupees for advertisement. That is to making making awareness program for the people, and the huge amount in the mass media conducting the awareness program. So by aware, if the mothers will be aware, then automatically the exclusive breastfeeding will be possible. And strengthen the supervision system to monitor the progress, quality, and impacts. Whatever may be, the practice is going on among the mothers, or the way of motivating whatever is going on, everything is okay. But the supervision system is also important. So the supervision system must be strengthened. For what? For monitoring the progress, quality, and the impact. Whether the progress of breastfeeding is there or not. If yes, then quality is maintained or not, or what is the impact. It must be monitored by the supervisors. Okay, so that is also important. Then mobilize the different funding sources to implement the plan of action. The different funding sources are also available, but it must be mobilized. That plan of action must be there to mobilize the different sources. Then another one is community support model. That is, the community-based support group model is effective. It is so much effective in improving the breastfeeding practices in low and middle income countries as well as high income countries. So mostly, you see, the peer support helps to increase the early initiation of breastfeeding, decrease pre-lactal feeding. That is, the peer supports the group of mothers are there in the community. If the group they are supporting each other, then automatically the initiation of breastfeeding will be increased. So the peer support is also very essential. As a health worker or as a health personnel in the community, we must find out that, and we must encourage for peer support. Then increase exclusive breastfeeding for infants aged 3, 4, and 5 months in low and middle income countries. That the exclusive breastfeeding must be increased. That's why the community support model is there. 3 groups were established in each village. That is group 1, group 2, and group 3. That is, one is already we discussed. One is exclusive breastfeeding group, and for 0 to 5 months. Then complementary feeding group, that is from children, mothers of the children, that is 6 to 23 months. Then community support group, that is 0 to 23 months. That is, this group, that is family members must be included, and they must take decision. That is, the 3 groups must be established in each village. Group 1 and 2 met once a month, and group 3 met once every 2 months. The hour-long support group meetings typically included 10 to 15 participants and occurred in a village hall. And during facilitated meetings, participants shared experiences, exchanged information, and supported each other. So, when you people are visiting the community also, you must see whether this group 1, 2, 3 is there or not, and how they are working, and how many meetings they are conducting, whether it is effective or not. Practically, you can see this. Then the breastfeeding, that is alive and thrive. You see, the alive and thrive, that is the material development, training, monitoring and evaluation, technical and financial support. These things are very much essential for breastfeeding. So the awareness can be possible, can make the increase the percentage of exclusive breastfeeding. That's why we need training. This needs also monitoring and evaluation, and also the technical support and the financial support. And then the Department of Health and Reproductive Health Center, they are working, and district health center or common health center, they are also working, and also in the village level also, that is the setup is also there, and district level also the training program or supporting supervision and reporting, everything is going on in different levels in different way. And the exclusive breastfeeding support groups are also there, and the target group, you know, that is the antenatal mothers or the mothers that is the postnatal mothers. And that is that we already discussed, that is the frequency, that is 1 meeting per month. Then in the complementary feeding, that you see the support groups, that is the target audience is mothers and the caregivers with the children 6 to 23 months old. And the frequency also here is also 1 meeting per month. Then you see the community, that is the supporting group, the target audience, that is the other members and decision makers in the family with children 0 to 23 months old. And the frequency, that is 1 meeting per 2 months. So this meeting can be held in the meeting hall of the village. If in the village the hall is available, so the meeting must be conducted and the groups must be developed and the breastfeeding must be encouraged and the mothers should be supported in this way to improve the exclusive breastfeeding. When you see how the breastfeeding practices is possible and how it is important, that is in the different levels. You see, first is the individual, then family, then community, then society. So all are interrelated. No one can exist without anyone. So all are interrelated. So individual, that is the, you see, which the mother is the individual. That is the child feature, mode of delivery, previous experience, that is parity, whether multipara or that is the primipara, that is the first pregnancy or first delivery, or what is the age of the mother, what is the income of the mother, or what is the educational status or working status, or intention to breastfeed, that is the important. So the what is the intention, that is what is the attitude of the mother for the breastfeeding, what is the self-efficacy, or what is the belief. So these are the things and the factors influencing the individual mother. And the family also, you see that the individual mother belongs to the family. And the family also, the factors are there, that is family income, partner, that is the husband of the antenatal mother, that is the partner, or support, that is the family support. Other family members are supporting her, the mother, the in-laws. They are having the great role in the family for the mother. So that is the support. How is the family environment? How the family is influencing the individual mother? So that things can be observed. Then comes to the community, because in a family, the community, it belongs to the community, and in that community, the health facilities are available or not. Which type of facility? Yes, then which type of facilities are available? Which type of services are being provided? And whether the family or the individual mother is able to access the health services or not. What are the cultural norms, cultural practices present in that particular community? So everything should be, what is the culture? You know, different religion is having different culture, different society is having different culture. It may vary from one society to another society, one area to another area. So that's why we must observe, we must study those things. Then society also, that is, you see, the community also belongs to the society, and there are so many policies, publicity, cultural norms, role of women in the society. These are playing important role for breastfeeding practices. So the role of women is more important than any other. So all the women must be aware about the exclusive breastfeeding and how the breastfeeding is important for the baby. So if the woman will be educated about the breastfeeding, then automatically we can achieve the goal. In stages of sense and communication approaches, you see, what are the changes or what are the communication approaches? That movement from one stage of change to another requires a mix of appropriate communication intervention from the following categories. So that movement, that awareness can be possible through mass media, electronic and print media, radio, TV, newspaper and flyers. You see how the government is, that is the expenditure is there for the mass communication or the public awareness. So these are the resources by which the public can be more aware. So community advocacy and events, that is the advocacy of the community is also very important, and they can change, they can motivate the family members easily. So there are theaters, fairs and community gatherings, so that also we can motivate. Then interpersonal communication through community groups, individual counseling, mother to mother support groups and home visit. And these approaches help change individual behaviors and social norms and are directed to mothers as well as to family members, community leaders, and other social, religious, and political influences. So, the individual behavior can be changed and they must be towards the breastfeeding, positive attitude towards the breastfeeding, which is very important. And from the research studies, we can able to know that dads make a difference. That is, the mother is having the also important role in the breastfeeding. So this is one, that is an exploratory study of paternal support for breastfeeding in Western Australia. That is, dads make a difference. That is, the ability to breastfeed and continue the practice requires dedication, commitment, persistence, and support. If the father is supporting, then automatically the mother can be more motivated for successful breastfeeding. And that is the, because for successful breastfeeding can maintain the balance of home, family, and work commitments. So the fathers want to be involved. So the study suggests that the fathers must be involved and be part of parenthood process, including infant feeding also. So this study is a qualitative exploratory design, and this was chosen to identify the parents' perception of what constitutes support for breastfeeding, particularly focusing upon paternal support. And the focus groups were conducted with mothers and a focus group, interviews, and an online survey were developed for fathers. And this thematic analysis was used to identify the main themes. And it is observed that out of total 76 participants, the major theme emerging from mothers' data identified that the dads do make a difference because the fathers is having a main role. They can make it more difference. So three sub-themes included that anticipating needs and getting the job done, encouragement to do your best, and paternal determination and commitment. These all are associated with effective partner support. This wants to be involved. So the sub-themes include wanting more information, learning the role, and being an advocate. So this is concluded that the breastfeeding is not only a mother's responsibility. There is need to leverage all sectors of society to make breastfeeding successful. The International Baby Food Action Network said in a statement marking the ongoing breastfeeding week from August 1st to August 7th, for which we are observing this week as the breastfeeding week, and we are organizing this type of webinar, seminar, or WhatsApp or CNE programs to make the society aware, to make the students awareness. Everything is going on for this. And the building and sustaining momentum around breastfeeding requires effective policy advocacy and social behavior change, which combines interpersonal communications, mass media, and community level programming. So the community support is very important for a successful exclusive breastfeeding. And I hope you, the participants, will acquire a good knowledge by attending this type of webinar and this auspicious World Breastfeeding Week. Thank you all. So, if you are having any doubt, we may ask. Hello? Hello?
Yes, ma'am.
So, have you any doubt?
No doubt, ma'am.
Can I ask you some questions?
Good afternoon, ma'am.
Very
Ma'am,
good.
I have the doubts.
Yes.
Ma'am, what are the contraindication of breastfeeding?
If there is, as per the, that is the medical ground, if the mother is having some health problems, which is advised by the doctor, then not to breastfeed, then only we can give. Otherwise, no contraindication. In some medical conditions, at that time, we may not give.
अपा नमस्कार बढ़िया प्रेजेंटेशन ହେଇଥିଲା
अच्छा अच्छा
तो प्रेजेंटेशन बहुत बढ़िया ହେଇଥିଲା अपा नमस्कार
नमस्कार नमस्कार now congratulations to you for your
हम कथा सुबुनी अपा
effort.
कोन म्यूट कर दीछे भी
mute. ଶୁଭିଲା କି? Thank you so much for giving me this opportunity. And once again, thank you to your management for making such a nice program. And
मझिरे मझिरे सुबुची सुबुनी ना मते केमती प्रॉब्लम होची ना समस्त नु
କାହିଁକି କିଛି କହୁନାହାନ୍ତି
हेलो
ହ୍ୟାଲୋ
पिल्ला माने
मैम
सब
ठीक
सुना
सुना
जाउची
जाउची
मते खाली सुबुनी
ଶୁଭୁଛି
मैम भल से सुबह
नो
जाउची
मैम हमको ठीक सुना जाउची Okay, thank you, ma'am. It was really a meaningful session. Now, I would like to call Dr. Ankita Jacob, ma'am, Principal, Kasturba College of Nursing, Odisha, to share her knowledge regarding techniques of breastfeeding. Over to you, ma'am.
Good afternoon, ma'am. Uh,
Hello,
Yes, ma'am. 1 minute. Actually, I'm not able to share my
what happened,
screen.
Ankita?
Yeah, ma'am. Not able to share my screen. Just give me 1 minute, ma'am. A very good evening to all. I extend my sincere thanks to Dr. Jagir Narayan Das, Mr. Suman Kumar Senapati, Professor Dr. Manjubala Das for giving us an opportunity throughout the organization of this webinar and all the program of Breastfeeding Week. I also uh, give heartful thanks to Professor Dr. Abhilekha ma'am, Professor Dr. Anusuya ma'am for enlightening us with her knowledge. The more we know about human breast, the more we know about human breast milk, the more we discover about its value. In human nutrition and development, a healthy mother may produce about 500 to 800 ml of milk a day to feed her infant with about 500 kilocalories per day. Human breast milk is the healthiest form of milk for babies. There are few exceptions, such as when the mother is taking certain types of drugs or is infected with human T lymphatic virus, HIV, or untreated tuberculosis. When we talk about initiation of breastfeeding, it should be started within half an hour of birth as soon as possible after normal delivery. Whereas in case of cesarean section delivery, within 4 hours, rooming in and bedding should be done with mother and baby to prevent separation and promote breastfeeding. Breastfeeding also helps mother for in many ways. Whereas artificial feeding is associated with more death from diarrhea in infant in both developing and developed countries. Breastfeeding is the feeding of an infant or young child with breast milk directly from female human breast via lactation rather than using infant formula from a baby bottle or container. Babies are having sucking reflex which enables them to suck and swallow the milk. Some are the factors which influence breastfeeding. They are nutrition, position, emotional status, attitude of mother, genetic factor, and privacy. Poor posture while nursing baby can quickly become a big pain in the neck with the possibility of sore, cracked nipples, milk supply problem, and mastitis. If we talk about nutrition, some specific nutritions are there such as iron, calcium, potassium, vitamin A and D, which are beneficial for the breastfeeding mother. In about 99% of cases, mother feel safe while breastfeeding at home. Few genetic factors are there which can affect quantity of production of milk and qualitative content of human milk. Infant feeding cues, when we come to know that baby need feeding now, bringing hands to mouth if the baby is bringing their hand to mouth, rooting if baby is showing rooting reflex, sucking reflex, licking and nuzzling, lip smacking, these are the sign of infant asking for feeding. Preparation, how mother should prepare herself for feeding. She has to wash her hand Position comfortably and correctly, use of pillows or towel for support, and uncover the breast. Position. First is sideline position. It is a first position yourself and baby on sides tummy to tummy. Bend your top leg and position with pillows. Place your finger beneath your breast and lift upward. Then pull your baby in close as she latches on. The sideline position is an especially good choice for breastfeeding if mother has cesarean or cesarean with spinal anesthesia. Uncomfortable sitting, if mother is having episiotomy suture and she is not comfortable to sit, then she can go for sideline position. And assistant, if the mother is having no assistance for breastfeeding, she can use this position. Next position is football position. This position helps babies. In this position, your baby, so her leg and body are under your arm with your hand holding her head. Place your finger below your breast. Allow your baby to latch on while pulling her in close, holding her head tightly against your breast. Keep your baby's body flexed at the hip and her leg tucked under your arm. This position is useful when cesarean birth and want to avoid placing your baby against your abdomen incision. You need more visibility in getting your baby to latch on. The breasts are large. You are nursing a small baby, especially in premature case. Your baby tends to slide down or areola onto your nipple. Your baby is fussy and restless and hard to latch on. Your baby is sleepy, sitting upright, and may encourage her to remain alert for a longer period of time. You have inverted nipple, and in case baby is very feeling sleepy, we can use this position. The cuddler position, or we can call it tummy to tummy. Sit as straight as possible with a pillow behind, or sit on the edges of bed. Cradle your baby in your arm, her tummy against yours, and her head resting in the bend of your elbow. Her ears, shoulder, and hip should be in straight line. Tuck your baby's lower arm out of the way with her mouth close to your breast. Support your breast with your free hand. Place all your finger underneath, which will help to away the areola. Rest your thumb lightly on top of your breast above your areola. Lift your breast upward and lightly stroke your nipple on your baby's lower lip. As part of the rooting reflex, her mouth will open wide. Pull her quickly onto the breast to latch on when her mouth is open wide, like a big yawn, and her tongue is down. Do not lean over your baby. Keep your back straight and pull your baby up to the breast. Then the cross cradler position. This position is same as cradler position, but just the opposite hand was used to support the infant, and the same side hand will be useful to hold the breast towards baby's mouth. Then we should use the cross cradle to learn latching to maintain comfortness of the mother. Latch on. Mother holds a baby in upright position on her lap. Mouth is wide open and the chin touches the breast. Mouth guide the nipple and areola into the baby's mouth. The effective milk transfer, peristaltic movement action from the tip of the tongue to the base. These are the few basic steps for breastfeeding. Make sure, if we say about, we should make sure you are comfortable and well supported with pillow. Lean back rather than sit upright. Place your baby on your bare chest between your breasts facing you. Gravity will help keep her in position. It's best if your baby is awake but not crying. If she is crying, calm her first, perhaps by letting her suck your finger. Then calm your baby, begin to follow his instinct. He will start to move towards her own towards one breast. Support your baby behind his shoulder and under his bottom. Let him move to where he is trying to go towards your nipple, he knows where to go. Actually, babies knows where they want to go. They are going towards the milk, so towards the breast. Your job is to keep him calm. You can help him by moving his whole body a little if necessary. Your baby will most likely position herself on an angle with her mouth near your nipple and her feet supported by thigh or lap. When your baby is just below your nipple, he will dig his chin into your breast, reach up with an open mouth attached to breast and start sucking. Sign of correct attachment. If the baby is attached correctly to the breast, her or his mouth will wide open, lower lip is turned outside, chin will be touches the breast, black part of the breast which is areola not visible below the lower lip, large black portion again which is areola of the breast and nipple including milk collecting duct are inside baby's mouth, tongue under the tet. Incorrect sucking position. Mouth is not wide open, chin is away from the breast, baby is sucking only nipple, most black portion areola, the breast is outside the baby's mouth, tongue away from the tet. These are the sign of incorrect sucking position. If these signs are present, baby is not taking milk properly. How to find poor attachment. If mother is having pain after feeding or during feeding, clicking sound heard by mother, eager to suck. Baby is very much eager to suck. These are the poor attachment sign. Process of nursing. Suck, swallow and pause. This will be followed by the baby. Baby will suck, then swallow, will take a pause, then again will suck, swallow and pause. Cuddle and fiddle with the baby by stroking and tickling behind his or her ears or on the soles of the infant does not lap into the sleep without adequate food. Delatching. Watch baby for cues that he or she is finished. Maybe spontaneously come off the breast when the baby's feeding is done. Spontaneously it may come out. May fall asleep. If mother wants to stop the feeding early, she wants to do some work, as much as we should avoid it, but if she has some work she wants to break the feeding, then she have to insert one finger into one corner of the infant's mouth, then she has to delatch the feeding. Burping, which is most important, propped up with the baby's tummy against shoulder of the mouth, sitting up leaning towards on one hand of the mother with the other hand burps at back of the infant. These are the two techniques to do the burping after the feeding. So we can expel the air which went during the feeding. Importance of good position and attachment. Ensure efficient milk transfer. Ensure sufficient milk supply. Prevent moms becoming sore. Relax moms having contented baby. In sign of successful breastfeeding. 1 or 2 wet diapers during the first few days. 6 to if baby is taking proper breastfeeding, he will be having 1 or 2 wet diapers during the first week. 6 or 8 wet clothes diaper per days or within 24 hours. At least 2 to 5 bowel movements every 24 hours. 6 to 10 feedings per 24 hours. Baby swallowing sounds are audible. Gain at least 120 to 210 grams per week after the 4th day of life. Appear healthy, have good color, firm skin, and will be growing in length and heart circumferences. Sound sleep followed by the feed. Advantages of the breastfeeding. Mother and baby both get the advantage while nursing or giving breastfeed. Breast milk has the exact combination of protein, fat, vitamins, minerals, enzyme, and sugar needed for the human infant at various stages of his growth. Contain optimum percentage of carbohydrates, protein, and fat. Due to the digestibility of breast milk, breastfeed babies are rarely to get constipated. Breastfeed babies tend to have less incidence of ear infection, respiratory illness, allergies, diarrhea, and vomiting. The stool of breastfed babies are mild smelling. For mothers, causes the uterus to contract, lessening the risk of postpartum hemorrhage. The uterus of breastfeed mother sinks to its pre-pregnancy size more quickly. Calories are burned while breastfeeding. It takes approximately 20 calories to produce an ounce of milk. Women who nurse their babies for at least 6 months lessen their chances of premenopausal breast cancer. Osteoporosis and cervical cancer are less common in women who breastfeed their children. The return of fertility is delayed with breastfeeding, so it is a good form of family planning also. Breastfeeding is more economical than formula feeding. Breast milk is always available, clean, and the right temperature for the baby. Many mothers feel a special satisfaction in knowing that they alone are meeting the nutritional need of their babies. So I'll conclude with the one message: support breastfeeding for a healthier planet. Anyone have any doubt can ask.